Well, hello again. Can anybody be too thin for a hip replacement? If you're overweight, we know that this increases the risk of surgery. I recently saw someone with a painful hip who's very underweight. She had taken advice from someone who told her to eat more cakes and biscuits to help her put on weight, but this nearly made her diabetic. In this video, we'll look at why being underweight can be just as bad as being overweight when it comes to hip surgery. Let's face it, if being human was straightforward, we'd all be happy and healthy, not too fat, not too thin, and full of the joys of spring. Just right, in fact, much like what Goldilocks wanted. But we live in the real chaotic world and have to deal with uncertainty and imperfection. Let's look at being underweight in more detail. What does it mean? Well, a standard measure of weight is the BMI. This relates body mass to height, the body mass index. It's good enough measure for most people, but for some people who are classified as overweight, they may just have lots of muscle and not much fat, so it has to be taken in context. The ideal BMI for most people is between 18 and 25. In most developed countries, people tend to be heavier than they should be, usually the result of poor diet and not doing enough exercise. But what if you're underweight though, like the patient that I saw? If your BMI is 18 or lower, you are underweight. The problem with being underweight is that your muscles and bones are more likely to be weaker than normal. You're probably becoming a bit frail, and this puts you at an increased risk of falling and breaking a bone. If this happens, you could be in real trouble because your reserves are low, and this can delay healing, putting you at an increased risk of serious complications like infections, blood clots and heart attack. If you need to have a hip replacement, this puts a strain on your body as it heals up after surgery. If your reserves are low then, you might struggle to rehabilitate properly. I had a look at the evidence and found a recent paper from Baltimore that looked at the risks of hip surgery if you're underweight. What they found was that compared to somebody who's in the healthy BMI range, underweight people are more likely to have a redo or revision surgery because of an increased risk of dislocation of the hip and fractures around the implants. This is important information to a hip surgeon like me because it helps me to choose implants that might be better at reducing these risks for people at risk. If there is an increased risk of dislocation, I use what's called a dual mobility bearing because it's more stable. I did a video on this in the past. I'll put a link to it below. So what advice did I give to my underweight patient? Well, I recommended that she should see a nutritionist to help her plan a strategy to increase her weight without eating cakes and donuts. Not too many carbs and plenty of protein is usually best. We talked about supplements like vitamin D to help her improve her muscle and bone strength. She should have a scan to see if she has osteoporosis, and if she does, she'll need to take drugs to stop it getting worse. These things can't be rushed, so it will take several months for her to get up to a healthier weight and optimise her condition before surgery. It's better to do that than rush into surgery before she's well enough to get the most out of it. Have you been advised not to have surgery because of your weight? What advice were you given? Did it help you? Please share your experience or leave a comment below. If you want to know more about anything to do with hip surgery, please get in touch. The details are below in the description. Thanks for watching, and I'll see you all again next time.